Anxiety is not what most people think it is. It's not overthinking. It's not weakness. It's not a lack of faith or willpower. And it's not something you can always see from the outside. That's exactly what makes it so misunderstood and so hard to talk about. Because anxiety doesn't always look dramatic. It doesn't always look like a panic attack or someone visibly falling apart. Sometimes it lives quietly inside a person who seems completely fine to everyone around them. And that silence is dangerous. Clinically, anxiety disorders have recognizable patterns. And while only a licensed professional can properly diagnose it, there are common signs that research consistently points to. Here are 6 evidence-based signs that are often associated with anxiety disorders. The first sign is persistent, excessive worry that feels impossible to control. This isn't normal everyday concern. This is the kind of worry where the mind keeps replaying future scenarios, usually negative ones, even when there's no immediate reason to. Even small situations can trigger intense mental tension, and the harder a person tries to stop it, the stronger it seems to get. The second sign is physical symptoms that have no clear medical cause. Anxiety activates the body's stress response. That can produce a racing heart, tightness in the chest, shortness of breath, muscle tension, sweating, stomach discomfort, or dizziness. These symptoms are real. They are not imagined. The nervous system is simply responding as if there is a threat, even when there isn't one. The third sign is disrupted sleep. Many people dealing with anxiety struggle to fall asleep because the mind won't slow down at night. Others fall asleep but wake up frequently or feel completely unrested after a full night. Chronic stress hormones can interfere with the body's natural sleep cycles in ways that compound over time. The fourth sign is difficulty concentrating and decision fatigue. An anxious brain is constantly working in the background, scanning for problems, anticipating outcomes, preparing for things that may never happen. That leaves very little mental space for focus or clear thinking. Even simple, everyday decisions can start to feel overwhelming. It's not a lack of intelligence. It's a brain that's been under pressure for too long. The fifth sign is irritability or a constant sense of restlessness. Anxiety doesn't always present as visible fear or sadness. Sometimes it shows up as agitation, frustration, or a feeling of being permanently on edge. The body feels tense. The mind feels crowded. From the outside it can be misread as a bad mood or a difficult personality. From the inside, it's exhausting. The sixth sign is avoidance. When anxiety becomes overwhelming, the natural response is to withdraw. This means skipping social events, putting off tasks, or staying away from certain places to avoid the feeling of panic. While it feels like safety in the moment, avoidance actually reinforces the anxiety over time, making a person's world feel smaller and smaller. Something important to understand here. Everyone experiences anxiety at some point. It is a completely normal human response, a survival mechanism the body uses to respond to stress or danger. It becomes a clinical concern when the symptoms are persistent, excessive, and begin to interfere with daily functioning, affecting work, relationships, or quality of life consistently for 6 months or more. This is not a diagnosis. This is awareness. If someone is experiencing severe distress, panic attacks, or symptoms that are significantly affecting their daily life, speaking with a qualified mental health professional is the right step. Anxiety is one of the most common and most treatable conditions. It does not define a person. Awareness is simply the first step toward understanding, and understanding is where things begin to change.